that. We're just going to check out a few areas throughout your body so I can see if there's imbalances. I'll start with this. I just want you to put these underneath your armpits, and while I check a few things, just keep them held between there, and then we'll just check them out to test your sweat glands. And I'm just going to check a few areas for placement to see if there's any pain that's radiating for you. So I just want you to let me know. I'm going to do a variety of tapping all over your body and let me know if there's any sensation or pain or if it radiates anywhere. Anything?
No.
No?
No. Why?
Nothing?
No.
Okay. No? Just stretch your leg out here. I guess maybe have you standing this part. Anything?
No.
Okay. I'll just get you to have a seat. And I'm just going to feel along your face. If you're comfortable with that, just check out some of the lymph nodes there. And then all throughout, kind of down in your arm. So we'll start with just behind your ear here. Just gonna check the pulse here. I'll get you to take out those so we're just looking to see if there's unevenness in your sweat glands there or imbalance on the one side. Alright, I'll just get you to have a seat laying down on your back, and I'm just going to do a quick thermal scan. So this is just where I run my hand over your body to see if there's any other areas that heat up versus the other. And I won't actually touch your skin. I'll just ask you to put your arms down by your side. Feel it there?
Mm-hmm.
Okay, so right elbow. Which makes sense because I do believe, I'd have to check my chart, but I do believe elbow is related to the cervical. Feel it there?
Yeah.
just gonna do some dermatome checks. So what I'm going to do is just brush down one part of your body and do the opposite side and tell me if there's any different sensation or anything noted differently, okay?
Okay. Is there supposed to?
No, it's just another testing for me.
Mm.
Okay, and then is it okay if I continue on down here?
Mhm.
I'll just reach. You might not be able to do this because you're. And then I guess there's not really any bilateral testing down here. Sorry, ticklish.
Mm-hmm.
Any differences?
No.
I forgot to do the neck here. Okay. We're gonna do a series of different assessments that I'll need your help with, and then some that I will just passively do on you. So we'll start. I'll get you to stand up so we can further investigate the knee pain, the neck pain, and your lower back. So at first I just want you to copy the moves that I do. So you're gonna go stand up all the way and then drop down on your heels and let me know if there's any pain with that.
That'll bend my lower back.
Okay. And then we're going to do a global flexion. So we're going to basically rotate everything in, take your wrists in, your elbows in, your neck down, and crunch down all the way down as far as you can go, and let me know if there's any pain with that. No? Okay. And then we're going to do the same thing, but you're going to fan everything out. It's global extension. So arms, wrist back, arms back, shoulders back, head back, neck, and then stretch back as far as you can. Okay, any pain with that?
Well, on the shoulder.
Which shoulder?
Right.
Okay, we're gonna do hip circumflexion. So we're gonna basically take your hip like you're jumping over a fence all the way back and then back again with the same side. Okay. So that left side is just a little bit wonky, but probably off balance from the amputee. We're gonna do the shoulders circumflexion also. So you're gonna take one shoulder and you're gonna take your arm, roll it all the way back, and then roll it back towards you again, same side. Any pain with that?
Yeah.
Okay. Okay, if it hurts, you don't have to continue. So the left looked worse than the right, or are they both the same?
The left's worse.
Okay, I'm just going to get you to rotate around, and we're just gonna do a trunk rotation, so if you can cross your arms over your chest. Is it okay if I do some line marking on the back for you?
Yep.
Okay. So you're just gonna rotate, I'm just gonna stabilize your hips, and I just wanna see you rotate to the right, and then back to center, and then to the left. Okay. And then I'm going to get you to, you can relax your arm, and then you're going to do, you can turn back around towards me, and we're gonna do neck rotation. So you're just going to, we'll start with actually the side bending of the neck, so just tilt it to your right as far as you can go, and back up to center, and then to the left. That's as much as you can move it. Okay. Then you're gonna flex it forward, so drop your chin down as far as you can go, and then all the way back. all the way back. Okay. So on both sides of your neck, you had 4. I'm just gonna get you to take a seat on the table here, not in the crack, and then we're going to, can you do it on the other side? Sorry. I'm just gonna stabilize if that's okay again.
Yep.
And I just want you to do the same trunk rotation, arms on your chest, and then do the right. Okay, and left. Okay. Okay, I'm just going to get you to stand back up. We're gonna do just another couple quick series of assessments for me, and I just want you to do a full walk towards me and then walk all the way back towards the window. Okay, and then walk back again. I'm just going to be off to the side here. Okay, that's good. If you want to turn around, I'm just going to do one quick visual assessment. And then I'm just going to take a feel on your vertebrae and then to see if there's any side bending and stuff of the vertebrae also. So if that's okay for me to do my palpation again.
Mm-hmm.
So you got a right rotation on all of your thoracic vertebrae. And your lumbar seems to be good. I'm just going to get you to do the same thing here, and you're going to just bend your neck a little bit forward, and a little bit of your shoulders can tip forward also. I'm just going to do the same, just a feel to see. So in flexion, it is improved. Thoracic. So we're going to do the same thing, but I'm going to get you to bring your neck all the way backwards towards me, just with a little bit. Yep, that's perfect. Okay, in extension, that's also improved. Okay, and we're just going to do some palpation if that's okay.
Mm-hmm.
And I'll just get you to bend forward. Okay. And then bend forward again. Okay. I'm just gonna do 1, 2, 2. So left, up, slope. Okay, I'm going to get you just to turn to the side, and I'm just going to do some landmarking if you're okay with that again.
Mm-hmm.
We're just going to palpate PSIS on the back. And then the anterior one also. If you want to just brace yourself on my shoulder, and I just want you to raise that leg. Okay. And I'm just going to. So slightly off on this side. I'm just going to do the other side. And same thing, if you want to just brace shoulder. And lift your leg. Okay, that's good. So it's 15 degrees on the sides. I'm just going to get you seated. If you want to go around on that side. Just going to do a couple more assessments. Same thing that we basically just did. So I'm just going to do assessing. And we'll get you to bend forward again. Yep. And are your knees tight to the bed on that side? Okay. Okay, I'm going to do the same spinal assessment again. So if you want to just look forward straight. And same thing, bend forward just a bit. Okay, same. You lay down on your belly. We're going to do the same assessments here. You got to keep your head straight when I do the assessment here. Okay, just going to do palpating again, just going down. Okay, if you want to put your elbows on your forehead and prop your head up. Yeah. Okay, and then back down. Let's put this back in for a minute. You can put your arms kind of on the side if you need. And up on your shoulders here. That's good. I'm gonna do the assessment. You gotta keep your head straight. I can try and take this out. I'm just gonna reach around in front here. So to the left. Interior. Then we're just gonna do the coccyx assessment and down in the sacrum. So just gonna do some landmarking if that's okay.
Yep.
Okay, and I'll get you come up on your elbows again. Okay, and that's good. Okay, I'll get you to flip over on your back again. And we're just going to take your legs in here and we're going to bend them at the knees. Put them down. And this is probably not going to be that accurate because you're amputee, but we'll try it. And then I'm going to lift it and bring it back to me. Okay, we're gonna do some passive range of motion here. So I'm gonna just lift your leg up and kind of move it all around. And I will tell you if I need help with anything when I'm ready. And then we're gonna do some restricted movements. So you're gonna pressurize 10% pressure, and I'll count to 10 3 times. Okay, and then I'll just get you to bend your knee and drop it like you're gonna angle it like that. Okay, and we're gonna start with this. So I'm just gonna reach across. Actually, I'm gonna do the opposite. I'm gonna reach across here, and I want you to pressurize up on this knee with 10% pressure for 10 seconds. I'll count out loud, okay? And up. 4, 5, 6, 7, 8, 9, 10. Relax. Again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And one more time. 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Okay. Same thing. We're going to do the leg here. So I want you to just push down towards me with your leg, and I'll pressurize up for 10 seconds again. 2, 3, 4, 5, 6, 10. Relax. Again. 6, 7, 8, 9, 10. Relax. And one more time. 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Okay. This one was pretty good. Okay, we're gonna do the same thing over here. Bend your knee here. It's pretty tight there. Okay, we're gonna do the same thing. Push down with your leg here. 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Again. 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Okay, I'm gonna get you to pull your leg in like this with pressure when I tell you. Okay, 2, 3, 4, 5, 6, 7, 8, 10. Relax. And again, you're gonna pull in 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And again. I'm gonna get you to push in here. 1, 2, 3, 4, 5, 6, 8, 9, 10. Relax. Again. 1, 2, 3, 6, 7, 8, 9, 10. Relax. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Okay. I'm gonna bend this out. And we're going to do the same thing. I'm going to pressurize down and you're going to push up on the count of, or for 10 seconds, sorry. Go ahead. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And again. 1, 2, 3, 4, 6, 7, 8, 9, 10. And relax. And again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Okay, I'll just get you to flip over on your belly because we're going to check out your knee or mobilize your knee a bit. Okay, I just want to check out this knee here and see. We're going to bend it all the way up. Is that sore in the knee? Okay, I'm going to get you to pressurize then. Down. And 1, 2, straight down, like you're gonna put your foot down like that. Okay, go. 1, 2, 3, 4, 5, 2. Relax. A little too heavy. Less pressure. Okay. 1, 2, 3, 4, 5, 6, 8, 9, 10. Relax. And again. Relax. Okay. And this one I'm going to lift your leg up. I'm going to get you to, I'm going to do this one too because this knee's a little bit tight, so I want you to pressurize down a bit like that. 1, 2, 3, 4, 6, 7, 8, 9, 10. Relax. 1, 2, 3, 4, 6, 7, 8, 9, 10. Relax. Just 1 second. Sorry, we have to do that again. Okay, pressurize down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And again. Okay. Okay, now I'm going to get you to just roll over on your back again. I'm going to do what's called the GOT. So it's just going to work a few things out that you have, and then we'll go to specifically fixing a few other things that you have that I found in the assessment. While you're back up, I'm just going to check your dorsal and plantar flexion. So if you want to just bend your foot, keep your leg flat, tip your foot up to the ceiling, and then down. Okay, and down towards the floor again. Okay, and up, up. Okay. Okay, we'll start with hip circumduction. So you can let your leg just be loose, and I'm just going to rotate your hip. Okay, this next one, not to startle you, is called a leg drop, and I'm going to take your leg and we're going to just drop it and use the vibration to kind of help any of the deep fascia that's restricted. So just move up the bed a bit so that your ankles are on the bed. Okay, so just let your leg go loose. We'll try it with your prosthetic. We'll see how it goes. Just let your leg go loose. Loose. Yeah. Okay. And I'm going to lift it up and let it go. Okay, let it go loose. Okay, the last one is just a couple second one again. I'm gonna lift this leg up, and I want you to pretend like, or essentially roll to the other side of the table, and I'm just gonna restrict this side. Okay. You can just do it with your hips, just like you're gonna shift your hips. Okay. Okay, and we'll do it again. 1, 2, 3. Okay. Again. And again. Okay. Okay, so the corrections that I need to check out for you are on your belly. Okay, we're going to start with a sacrum adjustment here. So because yours is all showing on the right, I'm going to get you to turn your head to the right. And I'm just going to do some landmarking if that's okay.
Yep.
Okay. So what I'm going to do is just load, put some pressure in the upwards fashion on the right hand side for 3 seconds. We'll do that 3 times, okay?
Mm-hmm.
I'm just going to check it. So I'll just do a quick reassessment of that so you can put your head back to neutral there. I'm going to just mark again. Okay, that corrected itself. So we'll go to the next adjustment. Let's do a check on that because I checked that in neutral. We're going to do a check when you're up on your arms. So just give me 1 second. Unmark it. Go back down for a sec. Okay, come up on your elbows. Okay, good. Okay, the last one, I just need you to flip over on your back again, and we're going to treat your right side. Okay, now we're going to treat that anterior pelvis tilt. So what I'm going to get you to, or I'm just going to get you to shuffle as close to the edge for here to the side for me, and I'm just going to do an adjustment here on that. So I'm going to bend your knee up here. You can relax this part, relax it, and I'll get you to let's shuffle onto the table just a little bit more. That's good. Okay, and then I'm going to get you to roll away on the table just so that I can put my hand underneath there. Okay. Okay. I'll lift it up. Okay, I'm going to push down from my arm, or my hand here, sorry, into where my other arm is, just for 10 seconds with 3 repetitions here, okay? 6, 7, 8, 9, 10. 1, 2. Another time. Okay. I am going to get you to sit up at the side of the bed here, just not in the crack of the table, so whichever side. And then we're going to just do, okay, the last thing is coccyx adjustment. Are you comfortable with me doing that?
Yes.
Okay, so I'm just going to go on the back side of the table, shift to the side, and then I will landmark your coccyx, and it'll just be anywhere. It could be a little bit to readjust it, just until I feel the fascia release in that area and relax for you. So I'm just gonna prop myself on the table beside you and kind of give you a little bit of a hug, and we're gonna lean over so I can do some landmarking. And I'm just going to move you in slow rotation. Okay, if you want to just hop off, I'll do one more quick assessment just to see how the rotation is. Just gonna locate the back here and the front. Lift your, if you need to prop your hand, just lift your leg up. Okay. Good. There, on that side. Same on this side. Okay, arm up.
10.
Okay, and bend forward.
9.
And up. Bend forward one more